everyone. We're back again for the next part of our video series where we just go through some of the details and story of Abbie's diagnosis, her birth, and then her care at Children's Hospital following her diagnosis of transposition of the great arteries. So we left off with me making it over to Children's Hospital to join Alex and Abbie. So we're going to pick up from there. And I have this book that we kept of all the details of every day just here so I don't forget anything, at least not the important stuff. So Abbie now is 8 months old. She just had her 8-month birthday. And so, yeah, she's doing great. She just had an echo that looked fantastic and follow up with cardiology. So she's doing really, really well. Okay, so on December 4th, I was able to, was the day after Abbie was born, I was able to go over to Children's Hospital. Alex picked me up from McGee, which is where I delivered, and I went up in a wheelchair to Abbie's room, got to see her again. I hadn't seen her since she was taken out of the room at McGee, and in that instance it was pretty traumatic because she had stopped breathing several times while I was saying goodbye at McGee, and it was related to the prostaglandins that she was on, the medication she was on to keep an extra valve in her heart open so that oxygen would be able to flow even before the surgery. But the side effect of that medication was that she would have a harder time breathing. That was really scary, and to have to say goodbye in that manner was hard because, I couldn't do anything. I had to stay back in a different hospital. But the next night, I was able to finally see her, and I got there probably around, let's see, probably around 8 or 9 p.m., and we ended up staying till 1 or 2 a.m. in the morning, which was probably a little too late. Just for us, we needed to get some sleep, and there weren't, beds in that particular room because we were in the CICU, which is the Cardiac Intensive Care Unit at Children's Hospital, Pittsburgh. So, first, they just kind of, Alex and the nurse told me about what she was on, the medications. There was a lot of monitors, a lot of IVs. She was still on the prostaglandins, but they were able to take her off later that night, off of that medication, which was a huge indicator that she was doing well. That her oxygen was, it was probably in the 80s, like maybe low to mid 80s without the surgery, but the fact that she was able to have oxygen at that level was pretty significant. So she was still had the nasal oxygen coming in just through the nasal tube, but she didn't need to be on prostaglandins anymore. And then the next several days, we just basically were focused on teaching her how to eat. We practiced breastfeeding, which she did really well at, and prior to surgery, and we also were trying to figure out what medications exactly she was needing before surgery, and trying to get that all figured out. So the first couple days, the 3rd, 4th, and 5th, she was eating probably like 20 to 30 milliliters of breast milk, and then at that point, it was donated breast milk because I wasn't getting enough of a supply. But the 5th, she got to 40 to 50 milliliters. And then on Sunday the 6th, she was at 50 to 60. So each feeding, she was getting bigger and bigger. But of course, that initial time after birth, you kind of drop a little weight. So she was getting bigger, but we had to just make sure that she was above that 5 pound, hopefully 6 pound mark before surgery. So she was born at 5 pounds 10 ounces. Probably dipped down a couple ounces the first couple days, and then worked herself back up to a little over 6 pounds before the surgery. And her blood sugars were looking good. Those first couple nights, those were a little unstable, so that's what we were praying would stabilize. We had lots of skin-to-skin time, which was really great, not just for her, but also for me to just get that bonding, because I didn't get that when she was born. She had to be monitored and taken away quite fast, so to get that time with her was really special. My husband was able to take a couple days after off, and then he returned back to work on the 7th, so she was 4 days old, and he worked just a day or two before her surgery, which was on the 10th. And basically, he would try to work from home when he could, so we live about an hour and a half away from the hospital. And how we did that was, because of COVID, the Ronald McDonald House was not allowing for more applications. They were completely full, so my husband thankfully had hotel points that his company, or because of the traveling with his company, he had accrued. And so we used those for the first week, and then the second week we had someone from our church actually allow us to stay at their Airbnb, which was a huge blessing. And the Airbnb was just about 12 minutes from the hospital, children's, so that was huge. So our days at the hospital would start around 6:30. Sometimes we would sleep in more if we needed time, or if we were at the hospital late, but rounds were around 8 o'clock. So we tried to be there for rounds, which is when the doctors come by and discuss every patient's case, and you kind of get the most details from that. And they talk about their goals for the day, what they're thinking, what they're considering, and if they're going to be changing anything. So we would stick around for rounds, we would hear everything, or we would come in and get the download from the nurse, and then we would work on just gaining weight and being stable for surgery. Finally, after the physician's conference, the surgeon conference on Wednesday nights, they decided Abbie would have her surgery Thursday around noon, and so we started preparing for that. Thursday we came in early around 6, and we snuggled and did some skin-to-skin, hoping that she would be able to get into surgery right at noon, because she had to stop eating at 3 o'clock in the morning in order for her stomach to be completely vacant, and not have any risks of choking or anything during surgery with anesthesia. So unfortunately, the surgery that was scheduled for the morning started late, and then it ended a lot later. And so because of just some juggling they had to do with the rooms, her surgery actually didn't start until 4 o'clock in the afternoon. So she was starving for the whole afternoon, and that was very difficult because you are holding your baby, comforting them, and you cannot give them any milk, no food whatsoever. And she was just on, a nothing diet for 4 extra hours than she actually needed to be. So that was frustrating for me, because she could have had food until possibly like 7 a.m. and it just didn't happen. It really wasn't anyone's fault, just sometimes these things happen with surgeries going late and ORs not being available. So thankfully, around 2 p.m., the anesthesiologist gave her permission to have some Pedialyte, some clear Pedialyte, and that seemed to help a little bit, but it was very hard. She was crying and fussing and obviously was very hungry, so it was one of the most difficult things. And then at 4 o'clock, they took her back for surgery. The person that took her was actually the anesthesiologist, and that was very difficult. Just the moment where you are giving up your child and you're not sure if you're going to see them alive or not. So I said goodbye, and the anesthesiologist said, "It's not goodbye, it's I'll see you later." And that was really kind of her to say, because it gave me a little hope. And she went back, took her back, and had about an hour of preparation, and then at 5:07, I think, they made the first incision and started her surgery. So she got out of surgery, it was supposed to be 4 to 6 hours, but it ended up being longer. She got out around 11 or 11:30. And during that time, my husband and I decided that we would go and try to get dinner and try to get our minds off of it, and then we came back and just sat in the lobby and watched American Ninja Warrior to try to not think about it too much. But it was very hard. And it wasn't until like 11 or 11:30 when I heard some commotion in the hallway, and I went to look around the desk and saw that there was a group of people rushing a bed through the hall, and the monitors were beeping. And I just thought, beeping is good, because she's alive still. And so, it's about another 45 minutes or so after I saw her bed rushed down the hall. They had to get her situated and moved onto the heater and just stabilized, that they let us go back and see. And actually, before we saw her, Dr. Castro, who was her surgeon, came and filled us in on a little of some of the details of the surgery. And he was wonderful. He just said, "It's okay, Mama." It all went well. And then he told us that it all went very well. There was just a complication at the very end with getting her heart started again, with when she was coming off of the ECMO. It was acting irregularly, which she actually had an arrhythmia right before the surgery, and so they were concerned about an irregular heartbeat. And so she did have an irregular heartbeat at the very end, and because of that, she was on a pacemaker right after surgery, and they kept her on that pacemaker. And but after we talked to him, it was really late at night, and maybe midnight, and he told us that we could go back as soon as the nurses were done setting her up. So we went back and got to say hi, and it was very, very difficult watching her with an open chest, because they don't close the chest until a day or two after, just to help with the swelling and make sure everything gets back to normal. So thankfully the nurse had prepared us, and we had actually looked up photos of other parents, kids that had had the same surgery, to just kind of prepare us for what she was going to look like. But yeah, so I'm going to go get her a bottle in a second. She's a little hungry, I think. You see the baby? See the baby? Yeah, but we got to see her, and then stayed for a while, and would call. The first few days after surgery, especially that first 24 hours, are very, very important. It is important for their healing, for their heart. You really find out a lot in that first day after surgery. So we kept our phones with us. We called the hospital for updates every couple hours, even during the night, just to make sure everything was going well. And I will continue another video to talk about just after surgery. But pre-surgery, that's what happened, and then during surgery, it was longer than we expected, but everything went really well, and Yep, I think that's all I have. We'll talk about feeding and, care and everything after surgery here at the next video. Thank you!